Hey guys, so when we talk about extrapyramidal symptoms, we're talking about things like frozen neck, ocular muscles, bradykinesia, dyskinesia, or just restlessness in general. So we see those most often in drugs that block D2 receptors. And first generation antipsychotics are notable for their strong D2 antagonistic activity. But just remember that there are other drugs with strong D2 antagonistic activity, and the drug metclopramide comes to mind. And it's an antiemetic. So if you have a patient who's in the hospital or who's been suffering from vomiting and they have no history of antipsychotic medication, if they're having these symptoms, it's likely because of the metclopramide. You also need to watch out for the second generation drugs. So even though they're called atypicals because they have less extrapyramidal side effects, they still can have those extrapyramidal side effects. And the most famous drug of the atypicals for that is the risperidone. So let me start off by classifying the EPS, or the extrapyramidal symptoms. So I'm doing it on onset: acute, what I call continuous, and chronic. So an acute EPS is one that presents suddenly with what I call frozen or contracted neck, tongue, mouth. And you're going to treat this with an anticholinergic drug called benztropine. And benztropine is actually really often used to treat the extrapyramidal symptoms. That's one of the main uses. It also happens to be a second-line drug for Parkinson's, and it basically alleviates the dystonia. And another drug that's also used is diphenhydramine, but I think benztropine is really the first-line drug. When we talk about continuous, I call that continuous restlessness. And that's the akathisia. Let's see, akathisia. And that is treated. That is relatively mild compared to the dystonia or the other EPSs that we see. But that's generally treated with a beta blocker. So it's propranolol is used. For chronic, divide that into how long after the drug was started. So if it was relatively recent or relatively a long time ago that you started the drug, that's how I divide the chronic onset of EPS. So relatively recently you started the drug, and the tremor is coming on gradually. The patient's gradually having rigidity, gradually having the shuffling gait, gradually having the mask-like faces. That's Parkinsonism. If it's been a long time after you started therapy and you have a dyskinesia all over the body, it can be anywhere in the body, that's tardive dyskinesia. Parkinsonism, again, is treated with the same drug we use for acute dystonia. That's the benztropine. So when you have antipsychotic-induced Parkinson's, you generally treat with benztropine. With tardive dyskinesia, there's really no treatment. And you've reached the end of my video.